If you're starting Medicare soon or you just want to learn more about it, then you've probably found that it's pretty confusing. But thankfully, it doesn't have to be. Really, the most important part of understanding Medicare and gaining an understanding of how the system works is knowing what the foundational parts of Medicare are and understanding how they function, which is what we're going to cover in this video today. We're going to cover the ABCs of Medicare so that you have a foundational understanding of how the entire Medicare system works. And then when you learn more about Medicare, you have a foundational understanding that you can go off of to inform the more complex and more complicated things that you learn in the future. All right, so with that being said, let's jump straight into Original Medicare. Medicare is split into 4 different parts: Part A, B, C, and D. Part A is referred to as hospital insurance. So this is going to cover inpatient hospital expenses, skilled nursing facility costs, as well as some in-home care. So when it comes to inpatient hospital care, it covers things like semi-private rooms, meals, medications, and general nursing that you would need in the hospital. And with skilled nursing facilities, Part A offers a certain number of days of coverage if certain conditions are met. Part A may also cover some medically necessary skilled nursing care, physical therapy, or other home health services. It depends on the situation, but Part A may cover some of that. And one more main thing to know about Part A's coverage is that it does also cover hospice care. So that's some of the main coverage that you'll see with Part A of Original Medicare. And when it comes to some of the cost, I'll get into the deductibles and the coinsurance a little bit later on. But with the premium with Part A, it should be $0 if you've worked 10 years or 40 quarters in the US and paid Medicare taxes. What you paid into Medicare taxes while you were working in the US will cover your Part A premium. So for most people watching this, that number is going to be $0. If you haven't worked 10 years or 40 quarters, then you probably will see a premium on your Part A. All right, with Part A covered, let's move on now to Part B, which is referred to as medical insurance. Part B is going to provide coverage for things like medical services and supplies, outpatient care, preventative care, and durable medical equipment. But let's take a more specific look at some of these things that Part B covers. First, looking at doctor visits and outpatient care, this would include things like office visits, specialist consultations, preventative screenings, and lab tests. And there are actually some more preventative services that Medicare will cover as well, including things like vaccinations as well as counseling. Now taking a look at durable medical equipment, this would include medically necessary medical equipment, such as wheelchairs, walkers, and oxygen equipment. And one of the last major things that Part B covers is ambulance services. Now you might be a little confused and think that ambulance services would fall under Part A, since Part A is considered hospital insurance. But no, technically, ambulance services actually does fall under Part B. And that's important when you get into the coinsurance that comes with Part B. But again, we'll get into that later on in the video. I will, however, tell you about the premium that comes with Part B, because unlike Part A, Part B does have a monthly premium of $164.90 in 2023. Now, that premium does fluctuate up and down every year as it's determined by the government. Most of the time it goes up, but this year in 2023, we actually saw it go down. So it just kind of depends on the overall economic landscape of the United States in determining what that premium might look like. So these two parts of Medicare that we just talked about, Part A and Part B, are known as Original Medicare. So anytime you hear me or someone else talk about Original Medicare, they're always referring to Medicare Part A and Part B. All right, so with Original Medicare covered and out of the way, I'm actually going to skip Part C for just a moment and move on instead to Part D, the last part of Medicare. You'll understand why I'm skipping Part C in just a moment, because it is pretty unique from the other parts of Medicare. So we'll start with Part D, and then we'll work our way back to Part C. Part D is where you're going to get your prescription drug coverage, and it comes through a private company. Part D plans are designed to reduce the cost of prescription drugs. And they have a wide list of medications, including generic and name brand prescriptions. Part D plans may also provide coverage for certain vaccines and supplies related to the administration of drugs. An important note about Part D plans, though, is that every plan has a formulary, which is a list of covered drugs. These prescriptions are broken up into cost-sharing tiers, and some prescription drugs on one plan may actually be more expensive than the same prescription drug on a different plan. It just depends on the cost sharing and how the different prescriptions are broken up into different tiers. These formularies, though, as you might have guessed, aren't standardized. So some plans may actually be better for your prescriptions than other plans otherwise would be. Also, just as a reminder, Part D plans are not provided through the government, but instead through private insurance companies that have a contract with the government. People still call it a part of Medicare, it's Part D, but technically it is through private insurance companies that have made an agreement with the government to provide that plan. And when it comes to the premiums on Part D plans, it does depend on the specific plan, but the average in 2023 is around $31. So that's a rough estimate for what you can maybe expect to spend on a Part D plan. All right, now that we've covered Part D, we can backtrack and now look at Part C of Medicare. So Part C is where we start to get into the bigger parts of private Medicare insurance. Part C is known as Medicare Advantage. Medicare Advantage plans are an alternative to original Medicare that's offered through private insurance companies that are approved by Medicare. These plans must cover everything that original Medicare, aka Part A and Part B, does. Most of these plans will also offer additional benefits like dental, vision, and hearing coverage, fitness programs, and prescription drug coverage. So if you got an Advantage plan with drug coverage, then you wouldn't need to get a Part D plan because that drug coverage would already be built into your Advantage plan. So really, when you think about what a Medicare Advantage plan is, it honestly is just an alternative choice to original Medicare. So in the first option, you got Medicare Part A and Part B through the government, and then you can get a Part D plan along with it for prescription drug coverage. Or you could choose a Medicare Advantage plan, which has to include everything that Part A and Part B covers. And most Advantage plans have drug coverage built into it, so it also would cover your Part D plan. So really the main benefit to Advantage plans is that some of the costs are lower, the premiums are typically $0, and there usually are extra benefits built into the Advantage plan, like some of the benefits that we talked about earlier. Another note about Advantage plans is that they have a network of providers that you have to adhere to if you're on an Advantage plan. There's a few different types of provider networks that you can find, but I won't get too far into that right now. If you want to learn more about Advantage plans, I'll put a link in the description to a different video that I've made talking more about Advantage plans and what you should consider when choosing one. All right, we did it. We made it through the 4 main parts of Medicare. Good on you for sticking through. Now there's 2 more main pieces of coverage that I want to talk about that you should know. The first is a hospital indemnity plan, or HIP for short. And the second is the second big part of private Medicare insurance that most people talk about, which is Medicare Supplement or Medigap plans. I'll start first with hospital indemnity plans because it's pretty short, but these plans, also known as HIPs, exist to fill some of the gaps in Medicare Advantage plans. And we encourage every single one of our clients that gets an Advantage plan to also get a HIP. Advantage plans have a lot of different gaps in coverage, and that mainly comes from the copays that you have to pay if you go to the doctor, if you go to the hospital, if you ride in the ambulance. I'll get into some of those numbers here in just a second, but that's what HIPs exist for, is to fill some of those major gaps that exist in Advantage plans. Because some Advantage plans are good, and they have good coverage, but you have to make sure that an unexpected hospital visit doesn't result in thousands of dollars of out-of-pocket cost. So that's what HIPs are for. It provides a lump sum amount of coverage that you choose, and then your monthly premium is based on the amount of coverage that you want. So if you got, for example, $5,000 of a lump sum hospital coverage with a HIP, then any out-of-pocket expenses that you would have on a hospital visit through your Advantage plan would be covered by the hospital indemnity plan. They would simply just write you a check for the amount that you have to pay out of pocket, so then you are fully covered. So let's break this down a bit more with an example. Let's say you had an Advantage plan and you had to go to the hospital for 5 days. The ambulance picks you up, and that immediately is a $290 copay that you have for that ambulance ride. And then for the first 5 days of a hospital visit, you have a $245 copay for those first 5 days. Now, after day 5, that number goes down to 0 for a while, but on those first 5 days, you've got a copay of $245 for every day that you're in there, 1 through 5. So now what you owe through copays is $1,515, which obviously can be a tough, unexpected medical bill if you had a surprise visit to the hospital. But with the hospital indemnity plan, they're going to see that $1,500 that you owe out of pocket and just write you a check for that exact amount. So now you don't have to worry about an unexpected hospital visit because you have the extra coverage that is filling the gaps in a Medicare Advantage plan. And now you don't have to worry about financial instability if something happens. You can instead just focus on getting better. Okay, so that's hospital indemnity plans. Again, I just wanted to cover it really quickly because it is super important to know about if you're considering an Advantage plan, because you need that kind of coverage for the gaps that exist in Medicare Advantage. And now the last foundational piece of Medicare that I want to talk about is the second major option that you have when it comes to private Medicare coverage, which is a Medicare Supplement or Medigap plan. Supplement plans are designed for those who are taking original Medicare instead of a Medicare Advantage plan. And supplement plans are designed to fill the gaps that exist in original Medicare. And original Medicare actually has some pretty big gaps. Did you know that Part A, which again is your hospital insurance on original Medicare, has a deductible of $1,600 that you have to pay before any coverage goes into effect? So if you thought that $1,500 copay that you had with Medicare Advantage was bad, this is a $1,600 deductible that you just have to pay before any coverage happens. And how long does it take for you to spend $1,600 in a hospital? Probably 30 minutes. And here's the real kicker with the Part A deductible. You spend the first $1,600 and then you've got some coverage, which is nice. But then when you get out of the hospital, if you don't use that Part A insurance for 60 days in a row, that deductible is actually going to reset. So let's say you go to the hospital, you spend the $1,600 copay, and then you get out. And then 3 months later, 90 days after the last time you were in the hospital, you get to the hospital again, you're going to have another $1,600 copay that you have to pay before any Medicare coverage goes into effect. And Part A also has some pretty nasty coinsurance if you have an extended stay in the hospital. So day 1 through 60, after you pay that $1,600 deductible, are going to be 100% covered, which is great. But if you're in the hospital for longer than 60 days, then day 61 through 90, you've got a $400 coinsurance payment that you have to pay for every single day that you're in the hospital from day 61 to day 90. And then after that, you have a coinsurance payment of $800 for the next 60 days after that. This is tens of thousands of dollars that can rack up on original Medicare if you have an extended stay at the hospital. And then with Part B, there is a deductible for that as well, but it's a lot less egregious. It's $226 for the entire year in 2023, which obviously is a lot nicer. The main problem, though, with Part B is that you have coinsurance, just like with Part A. And this coinsurance is an 80-20 split, meaning that all expenses that you have that are covered under Part B, you are responsible for 20% of those costs, and there is no maximum out-of-pocket limits. So with a 20% coinsurance with no cap, these costs can rack up way faster than you would ever expect. But thankfully, there are ways to mitigate this cost risk that comes with Original Medicare, and that's done through Medicare Supplement plans, which exist to fill these exact gaps in Original Medicare and more. There are 10 different types of supplement plans, and they all just vary on how much they cover of certain gaps, as well as their average monthly premiums. Here's all the supplement plans listed on screen. Yes, I know, they also use a lettering system. Just make sure not to get them confused with Part A and Part B of Original Medicare. Out of all of these plans, though, there's really only 3 that we care about: Plan F, Plan G, and Plan N. The other ones provide some of the essentially same coverage just for more expensive prices, or their coverage isn't good enough to justify the premium cost. So these 3 tend to work out best for almost everyone that's looking at supplement plans. So let's go over these 3 plans and talk about what they cover. Plan F is awesome because it's going to cover all of the gaps. It covers the Part A deductible, the $1,600. It covers the Part A coinsurance. It gives you an extra 365 days of 100% coverage in the hospital if you have a pretty long extended stay. It covers the Part B deductible, $226 in 2023. It covers the 20% coinsurance and more. Plan F really does cover all of the gaps. We call it the Cadillac of coverage. However, something important to know about a Plan F is that you actually cannot enroll for a Plan F if you became eligible for Medicare on or before January 1st of 2020. Now, for most of you, that time when you become eligible for Medicare is going to be your 65th birthday. So if your 65th birthday was on or after January 1st of 2020, then you unfortunately cannot enroll in a Plan F. Now, thankfully, even if you aren't eligible for a Plan F, a Plan G will be right up your alley. Plan G is great. We actually call it here in the office the greatest value because Plan G is going to cover everything that a Plan F covers except for the $226 Part B deductible. But aside from that, everything else is covered. So if you're new to Medicare or you're just considering a supplement plan, then a supplement plan G would be your best option for your coverage. Now, the last notable supplement plan is a Plan N. Now, Plan N is extremely similar to a Plan G, and it's just considered a more cost-friendly alternative when it comes to the premium. So with the Plan N, it's very similar to a Plan G, as in the Part A deductible and coinsurance is going to be completely covered, but the main difference comes in the Part B coverage. So you still are going to owe that $226 deductible, but the main difference comes now with co-pays that you have to doctor's visits and the emergency room and specialist. You have co-pays for your Part B expenses. So for example, with a doctor visit, you have a $25 copay that comes with that. Or if you go to the emergency room and you aren't admitted into the hospital, you have a $50 copay for that. So really, that's the biggest difference between a Plan N and a Plan G. It's just that a Plan N is now going to have co-pays for Part B expenses, whereas a Plan G does not have co-pays for Part B expenses. And one last thing that you need to know before we wrap up this section on Medicare supplement plans is that supplement plans have standardized coverage. So that means that a Plan G, for example, in Ohio with Company A is going to have the exact same coverage as a Plan G in Missouri with Company B. It doesn't matter the state. It doesn't matter the provider. That coverage is going to look the exact same. And with that, we have covered the foundations of Medicare. I know that we went through a lot of information, so feel free to save this video so that you can reference it again in the future if your mind ever gets fuzzy on one of these foundational topics. But of course, this video just covered the foundational building blocks of Medicare. There are still a lot more nuances about specific plans, nuances in specific states, and more. So if you have questions about what plan might be right for you and your situation, then you can visit our website linked down in the description below, or you can give us a call in our office where you can speak one-on-one with a Medicare advisor who can help you figure out what would be best for you and what plans are available in your area.